A respiratory therapist, RT, is a specialized healthcare professional trained to assess, diagnose, and treat patients with breathing or cardiopulmonary disorders. Whether in hospitals, clinics, or home care settings, RTs are vital in managing both acute and chronic respiratory issues for patients of all ages, from premature infants to elderly adults. Their role is especially critical in emergency care, disease management, and rehabilitation. This video provides an overview of a respiratory therapist's key responsibilities, required skills, and educational path. Overview of the role. The main goal of a respiratory therapist is to help patients breathe more easily. They may administer oxygen, operate ventilators, clear airways, deliver inhaled medications, or support patients with chronic conditions like asthma, COPD, and cystic fibrosis. While RTs work under a physician's direction, they often make independent decisions based on patient assessments. Their work combines clinical knowledge with the operation of advanced medical equipment in high-pressure environments. Core responsibilities. 1. Assessing patients. RTs evaluate breathing by reviewing medical histories, listening to lungs, monitoring oxygen levels, and analyzing symptoms. These assessments guide treatment decisions, especially in critical care units. 2. Administering treatments. They deliver therapies such as oxygen, nebulized medication, chest physiotherapy, and airway clearance. For chronic cases, they create and adjust long-term care plans. 3. Managing ventilators. RTs operate and monitor mechanical ventilators for patients who can't breathe on their own, ensuring correct settings and adjusting them as needed. They also conduct weaning trials for recovery. 4. Conducting tests. They perform diagnostic tests like arterial blood gas, ABG analysis, and pulmonary function tests, PFTs, interpreting results to assist in diagnosis and guide treatment. 5. Emergency response. RTs are first responders during respiratory or cardiac emergencies. They assist with intubation, CPR, and setting up ventilatory support, often playing a life-saving role. 6. Patient education. They teach patients and families how to use inhalers, oxygen devices, and home ventilators, promoting self-care and reducing hospital readmissions. 7. Assisting in procedures. RTs support physicians during procedures like bronchoscopies, ensuring the patient breathes properly and managing respiratory equipment. 8. Documentation and reporting. Accurate record-keeping of treatments, responses, and test results is essential. RTs share this information with the healthcare team to ensure coordinated care. 9. Equipment maintenance. They ensure all respiratory equipment, ventilators, oxygen tanks, CPAP, BiPAP machines, is clean, functional, and safe for use, performing routine checks and maintenance. 10. Working across settings. RTs provide care in diverse environments: hospitals, outpatient clinics, long-term care facilities, rehabilitation centers, and home settings. Essential skills. 1. Clinical expertise. Understanding of respiratory anatomy, diseases, and treatments. 2. Technical proficiency. Competence with ventilators, monitoring systems, and diagnostic tools. 3. Critical thinking. Fast, accurate decisions in high-stakes situations. 4. Communication. Clear interactions with patients, families, and medical teams. 5. Teamwork. Collaboration with nurses, doctors, and therapists. 6. Attention to detail. Accuracy in administering care and recording data. 7. Emotional resilience. Staying calm and compassionate under pressure. Education and certification. 1. Education. An associate's degree in respiratory therapy is the minimum. Many pursue a bachelor's for advancement. 2. Licensure. Most states require licensure, typically by passing a national exam. 3. Certification. Credentials like Certified Respiratory Therapist, CRT, or Registered Respiratory Therapist, RRT, from the NBRC are often required. 4. Continuing education. Ongoing training ensures up-to-date knowledge and license renewal. Work environment and outlook. Most RTs work in hospitals, especially in ICUs, ERs, and neonatal units. Others work in rehab centers, home care, or sleep clinics. Demand for RTs is growing due to the aging population and increased respiratory illnesses. RTs with advanced training can move into leadership, education, or specialized care such as pulmonary rehabilitation or sleep disorder treatment. Conclusion: respiratory therapists are essential healthcare professionals, combining clinical skill with compassion. From life-saving interventions to chronic care support, they help patients breathe easier and live better. As respiratory health continues to gain focus, RTs remain at the forefront of patient care, improving lives, one breath at a time.